Good day, my friends, and welcome on back to the channel. For this discourse, we will talk about epidemiology, approaches to prevention and clinical practice. The importance of epidemiology for all of this. Now, we remember, say we don't already define wetin epidemiology be, and we talk say epidemiology na that branch of medicine or science wey dey look at determinants, risk factors, causes, and spread of disease. Etiology, wetin dey cause a disease. You know, say epidemiologists na people wey we dey look at as like disease detective. They wan know wetin dey sup, wetin dey about this particular disease. They wan know everything wey bin concern that disease. Now, we need to know say prevention dey very important in epidemiology. Everything wey concern epidemiology dey focus a lot on prevention, because for public health we know say prevention dey much better than cure. Now, we don do a video where we bin don discuss the different types of prevention measures or prevention: primary, secondary, and tertiary prevention. If you get time or you need to learn that, go check out that video, go see wetin we bin discuss for there. For here, we go look majorly on wetin we dey call approach to prevention. E get two major approaches wey dey to prevention. The first one na wetin we dey call population based approach, and the second one na high risk approach. Population based approach and high risk approach. Wetin be population based approach? Now, if you talk about population based approach, you dey talk about prevention method wey be say e dey targeted at the whole population. Any measure wey public health people or epidemiologists or doctors dey push out wey be say this measure na just for the whole population. Things like advice on lifestyle, advice on the use of alcohol, advice on smoking, immunization for the whole country, for all the under 5 children wey dey for inside the country. All these kind measures, say okay, we dey do mass media campaign, say okay, make people dey use fluoride toothpaste. All these different kinds of measures na wetin we dey call population based approach, because we dey just push out the measures into the population. No be say we dey target any particular person per se. We just push out these measures, push out this intervention into the whole population to make the population more healthy. Now, the second approach na the high risk approach, and the high risk approach na special approach because e dey target people wey we dey call the high risk individuals. Now, who be these high risk individuals? Na people wey get very high probability say they go get this disease. People wey dey obese now, e dey very important say we check their weight, or people wey dey overfeed. For an example, e dey important say we fit dey follow them talk say they fit get obesity come begin dey get heart problems. So for all those kind of people, they be high risk individuals, and we go target them, we go look for them, and we go do this intervention on top them. Now, this high risk approach dey much more expensive, and many a times to identify say this individual na high risk individual, e fit need some kind procedures, e fit need some kind medical tests, e fit need urine sample or many other medical tests like that to fit determine say okay, this individual na high risk individual. But once we don determine say this individual na high risk individual, we go come know the measures wey we go give the person to try to improve the health of the person, or to try to make sure say we prevent the person from coming down with these illnesses. This one dey important for us to know. Now, e also dey important for us to know say epidemiology get role wey e dey play for clinical practice. That's for our doctors and our nurses. And some of the roles wey e dey play na to determine wetin we dey call prognosis. Now, wetin be prognosis? This na the natural outcome of a disease. Wetin go happen if person don get so disease? Wetin fit happen if person don reach stage 2 or stage 4 of cancer? All this information na wetin we dey refer to as prognosis. And this information na epidemiology dey give this information. How epidemiology dey take give this information? E dey give this information based on data. Epidemiologists dey gather a lot of data. They go dey analyze this data and dey push out information from this data wey they don analyze. So for prognosis during clinical practice, now prognosis, as I don talk, na information on wetin be the likely natural outcome of a disease. So based on data wey epidemiologists don collect, they fit give information. They fit help doctors to give information to patients concerning disease, say na so this disease go progress. So if anything no happen, na so e go dey go, na so e go go be this. So this na some of the things wey epidemiologists dey do. Thank you for listening to this lecture. Do have a wonderful day. Thank you.